Hi everyone, I'm Dr. Ansuman Matthew and I'm a registered pharmacist. Today I'm here to make you all aware regarding headache disorders. So, what are these headache disorders? We all get headaches sometimes, and the vast majority of them are nothing to worry about. There are so many things that will make your headache worse and can even bring it on. Headache disorders are among the most common disorders of the nervous system. Headache itself is a painful and disabling feature of a small number of primary headache disorders, namely migraine, tension-type headache, and cluster headache. Headache can also be caused by or occur secondarily to a long list of other conditions, the most common of which is medication overuse headache. Tension-type headache is the most common primary headache disorder. It often begins during the teenage years and it affects 3 women to every 2 men. The mechanism may be stress-related or associated with musculoskeletal problems in the neck. This headache is described as pressure or tightness, often like a band around the head, sometimes spreading into or from the neck. Cluster headache is also a primary headache disorder. It is characterized by frequently recurring, like it can occur up to several times a day. It's brief but extremely severe headache, usually focused in or around one eye with tearing and redness of the eye. Also, the nose runs or is like blocked on the affected side and the eyelid also may droop. Migraine is also a primary headache disorder. It is more common in women, usually by a factor of about 2:1 because of the hormonal influences. It is caused by the activation of a mechanism deep in the brain that leads to the release of pain-producing inflammatory substances around the nerves and blood vessels of the head. Migraine is recurrent, often lifelong, and characterized by recurring attacks. The attacks typically include headache, which is of moderate or severe intensity, and it is pulsating in quality and it is one-sided. And the other characteristic features include the nausea. It is the most frequently observed characteristic feature associated with migraine headaches. And in children, the attacks tend to be of shorter duration and abdominal symptoms are more prominent. The common reported triggers of migraine headache include the food triggers such as alcohol, caffeine or caffeine withdrawal, fermented and pickled foods, tyramine containing food, nitrate containing foods like processed meats, and the environmental triggers include the glare or flickering lights, loud noises, strong smells and fumes, tobacco smokes, and in the behavioral and the psychological triggers it includes like excess or insufficient sleep, fatigue, menstruation, menopause, skipped meals, the strenuous physical activity like prolonged overexertion and so on. The other important type of the headache disorder is the medication overuse headache. So what is this medication overuse headache? Medication overuse headache or the medication induced headache is the third most common cause of headache after migraine and tension type headache. About 1 person in 50 develops this problem at some time in their life. Medication overuse headache is caused by taking painkillers or triptan medications too regularly for tension headaches or migraine attacks. Medication overuse headache is an unpleasant and long-lasting headache. People who have these headaches often take more and more painkillers to try to feel better. However, the painkillers have often long ceased to work. Opiate-containing medications such as codeine tend to cause problems most frequently. Non-steroidal anti-inflammatory drugs are less likely to cause a medication overuse headache but can do so, and these include ibuprofen, aspirin, naproxen, and diclofenac. The amount and frequency of medication use needed to cause medication overuse headache is not clear. It varies between different people, and it is possible that some people have more sensitive headache sensors than others. So how can we fix this headache triggers? Like one of the most common triggers is the poor posture. Poor posture causes tension in your upper back, neck and shoulders, which can lead to headache. So avoid sitting or standing in one position for a long period of time. Sit up straight and support your lower back. So as I've mentioned earlier, there are a lot of food items which can trigger the migraines and all. So once you suspect a certain food is causing the headache, eliminate it for a couple of months and see if there is any kind of improvement. Bright lights and glare, especially flickering, can induce migraines. This is because the bright light and flickering lights boost levels of certain chemicals in the brain, which then activate the migraine center. So, if you're a person who constantly works with the computer screens and all, adjust your computer monitor or attach a glare screen. And if the light is like so bright, like if you cannot adjust to that light, substitute it with some other form of lighting. Identifying and avoiding the triggering factors is also very important as it helps to prevent the recurrence of the headache. And also, behavioral interventions such as the relaxation therapy may also help. Do make an appointment with your general physician if you got a headache after a head injury, or your headaches are worsening and it's accompanied by high temperature, or if you have developed some problems with your speech and balance along with headache. So it is very important you have to consult your general physician. So manage your stress levels, eat a balanced regular diet, also perform regular exercises, drink plenty of water and have plenty of sleep. So anything that you can do to improve any of these areas of life will improve your health and well-being and reduce the number of headaches you experience. So share this information to everyone. Thank you for listening. Stay safe and stay healthy, everyone.